big concern for everyone in Manitoba. As I've said before, for a long time in Manitoba, we were successful at being able to prevent COVID-19 from being spread in personal care homes. We are grateful for the amount of time that we were successful in that, and of course now we've crossed the threshold and we have COVID-19 in a number of personal care homes, and so in all cases we are responding. The operator of the facility, the health authorities that are involved, the Department of Health and its oversight capacity, public health as well, of course, having a role. All of us working together, as Dr. Friesen would like to say, we're all in this together, and that is the case also when it comes to responding at personal care homes where there are outbreaks taking place. Of course, we pass on our sympathies, condolences to the families who have lost loved ones. One death is too many in Manitoba, and we've had too many deaths, as all Canadian provinces have had. So we will continue to work hard every single day to put the safety of Manitobans first and foremost in all of our responses. I'll be happy to take your questions.
I know there's a lot of factors that go into it, but for hospitals, you're at over 80 people, patients, COVID patients in hospital now. I know it depends on who else is going to the hospital, and the intensity of the illnesses people have. But can you give us some idea of what range, the numbers we have to be at for hospital admissions, for elective surgeries we have to be postponed again?
No, I won't give you that range, but I can give you the assurance that that range is being contemplated. We were proud to restart our surgeries and procedures and diagnostics program to try to catch up against the shortfall created by COVID-19. Obviously in the spring, Manitoba as well as other provinces closed down those elective surgeries and procedures to be able to redeploy workforce. We have been bringing those services back online. I got an update just yesterday on how we were doing to be able to bring those things back online. And at a certain point in time, as you say, if the numbers continue to go in the wrong direction on COVID-19, then we have to think about how we would curtail those in order to keep people safe in hospital and able to concentrate our efforts elsewhere. So while I won't give that range today, I can tell you that there's a lot of scrutiny paid to that planning, contingency plans that are drawn up, and that capacity is constantly reassessed in real time according to the conditions we're facing.
Why won't you give the range?
Because the range can change.
Is our healthcare system close to the brink? Was it not 2 days ago?
Look, I mean, our healthcare system is good at being able to plan for contingencies. When it comes to planning for COVID-19, that's included. In other words, just since the spring, we've brought in another 150 ventilators into jurisdiction. And that's all part of the plans that we've made in order to expand capability and capacity. When it comes to things like our ICUs, it's important to keep in mind that we can redeploy workforce, we can redeploy resources in order to meet the coming challenges. So I would say to you that the way to understand this is to think about it in terms of escalating, the challenge of escalating conditions, and what we're doing in each case is planning for interventions and deployment of workforce and resource according to the conditions that we face. So we're conscious of the fact that there are more people in hospital now than there were just 2 weeks ago. Clearly that is not the direction that anyone in Manitoba would want the numbers to go in. We are planning accordingly. We are not at a breaking point.
Do you have space outside of hospitals to house patients in the event they got to that?
Well, look, I would want to make it clear that we are not there. But yes, it is the responsibility of government and the healthcare system to be planning for all scenarios. So I can tell you that the plans, those contingencies to be able to avail ourselves of other spaces, those things have been in play for probably the last 6 to 8 months.
Those were part of the original planning?
That's correct.
What kind of space are we talking?
Being able to decant patients who would be of less severity to other settings. Those are plans that all Canadian provinces and territories have made. We are thankful that we have not had to at any point exercise those plans. But of course, I would say every single day in the system, Manitobans should know that system leaders and medical leaders, administration is hoping for the best but planning for every single option.
Where would you decant the two, though? We're talking about hotels, gymnasiums, hockey arenas? What are we talking about?
Yeah, all of those things could be contemplated.
Yeah, you've secured spaces in all of the above?
We have secured spaces, that's correct.
You were talking about a backlog in surgeries.
I'm sorry, is there a point where the government considers taking over management of Parkview Place, getting in military?
Well, we've seen that, right? We saw in Quebec where it was ordered that the Red Cross would go in and help out. Clearly, in the case of Parkview Place, we are monitoring very carefully. I'm getting daily updates as to the precautions being taken to see how the provider is responding to the issues that were identified in the inspection, virtual visits ongoing, capacity analysis ongoing, and as we said, many resources right there now in the facility that were not there even weeks ago. A doctor, nurse practitioners, 5 days a week, more nurse management, more nurse resource happening all the time. But that said, I would simply say it's all hands on deck. And nothing's off the table if it would be presented as evidence that somehow the operator was no longer able to operate safely and in the best interest of the residents. Then that would be the point at which we would be flexing to other plans. But of course, we are not at that stage.
So there's no evidence of that at this point?
No, the evidence most recent to my desk continues to show that while there is strain at that personal care home, and indeed at other personal care homes where we have COVID-19, clearly there are things that need to be done, and that's what we're attending to, that we are at the time being holding our own.
What would the evidence need to be for you guys to step in and say that they can no longer safely operate the facility? What would the evidence have to actually show?
So it would be a wide array of signals that care was becoming unclear, or that there wasn't the ability to manage the facility in other ways, housekeeping and food services. I can tell you in all of those cases right now, those are still in place. We continue to ask those questions on a daily basis. What's the satisfaction level of the residents? What is the facility reporting? What is WRHA response team indicating? How is that oversight capacity working to determine what comes next? So right now, we're not in that place, but obviously, as leaders, we must plan, and that's why we have been planning.
You said you had an update on the surgical backlog. What's the number now for people still waiting for surgeries? Do you know?
I'm not sure I said I had an update. I can tell you this update, that I believe by next week, every single one of the solicited contracts in Manitoba to be able to eliminate the wait lists created by COVID will be in place and activities underway. And I believe that in the next number of weeks, should we not have to curtail or slow those activities, we'll be able to start giving some regular updates on how we're doing. I understand right now that some areas that are going quite well are in eye surgeries, and there's some pediatric surgeries coming on, some outpatient spine surgeries that are happening that weren't happening before. So encouraging signs, but all this we say, subject to review, should hospitals continue to become busier and should hospitals continue to see spread of COVID-19.
We're seeing examples of epidemiologists facing online harassment and misinformation spread about the pandemic. I just wonder if that's a concern for the government and how you can kind of counter that misinformation online that might cause public harm in a pandemic.
I'm not aware of these reports you're saying. I'd be happy to review them. I've not heard about epidemiologists suffering harassment. Would be happy to look into the claims. I know when it comes to public health contact tracing, I just recently had the opportunity to be at Deer Lodge Centre last week, speak to the administrators there, speak to those Manitobans who are serving us every day there with their headsets on, engaging with the public on contact tracing, case investigation, and on things like daily follow-up. We're very, very thankful for their activity. We're very thankful for the commitment that they're making, and we want everyone, even despite the fact that these are challenging conditions, that many people are under stress, we want people to know that they can work in a respectful workplace. So if there's evidence to the contrary, we would want to address that.
How many contact tracers are there?
I can get that number for you. Remember that contact tracers, though, you have to keep in mind that that number is growing every single day, because we are asking our conventional system of contact tracers to do more. We are finding ways to redistribute our public health workers to be able to eliminate that backlog that's created and to be able to focus their efforts on doing that work, but also at the same time, we are onboarding that Red Cross resource. We're very encouraged to be able to have signed that contract with the Red Cross. I can tell you that already this week, those contact tracers, that workforce is in place. They have been onboarded, and we're understanding that we can continue to escalate their response on a daily and weekly level. Besides that, we are also expectant that the work that has been done to work with Stats Canada to bring additional resource online will bear fruit in the next week or two.